Good morning, dear friends. This is Dr.Ashish Chauhan from Manipal Hospital Whitefield. Continuing with our series on occasion of the World Heart Day, today we will be talking about syncope. What is syncope? Syncope is a brief or a transient loss of consciousness from which the patient recovers almost immediately. So the history would be that the patient was standing in the sun or at a bus stop, suddenly fell down and then got up, got better, was riding a vehicle, felt very dizzy, felt as if there is darkness happening, sat down for a while, felt better. Patient was walking in the lawns, had this same feeling of tunneling of vision, sweating, vomiting like feeling, either fell down or sat down, got better, got up to pass urine, fell down in the bathroom. So all of these patients, when they have a brief or transient loss of consciousness, they come under the broad term of syncope, which needs to be evaluated. Now 70% of syncopes are due to the heart or vessels, that is arising due to cardiovascular causes. About 10% are neurological, 10% are ENT, and 10% are idiopathic. That means we really don't know the cause. So how do we evaluate these patients at our center?
Manipal Hospital Whitefield.
We run a syncope clinic. We are specially enabled to assess for all causes of syncopes. In elderly, they may have a sudden drop in blood pressure causing this problem. Elderly have weak nerves. Diabetics may have autonomic neuropathy. All of these groups of patients are unable to constrict the vessels in their legs when they stand up, and their blood pressure falls, causing them to fall unconscious. In some people, the heartbeat may manifest in such a manner that the heart rate reduces drastically and this patient becomes unconscious. So how do we assess? We look for an echo of the heart. We look for the carotid Doppler, that is the Doppler of the blood vessels taking blood to the brain. We look at the rhythm of the patient, and behind me you see a tilt table. Not many establishments are doing this test. This is known as a head up tilt test, or HUTT, in which the patient who comes to us in a fasting state is made to lie down and then tilted at 70 degrees. While the patient is tilted at 70 degrees, his or her ECG, blood pressure, oxygen saturation is being monitored all the time. And over a period of an hour, we can determine the cause of the syncope. As they say, if you know the cause, you can fix the problem. So we are able to treat our patients of syncope definitively and almost permanently.